What if I told you that the simple habit of holding your urine for just a few extra minutes each day could be silently destroying your prostate, stealing your sleep, and accelerating your decline toward complete loss of bladder control? You probably think waiting until you really need to go is harmless, maybe even shows good discipline. But here's what's truly alarming. Over 50% of men over 60 are unknowingly damaging their prostate every single day through this one trusted habit, creating a cascade of problems that rob them of peaceful sleep and masculine confidence without them even realizing what's happening to their bodies. For thousands of years, traditional healers understood that immediate response to the body's natural signals was essential for maintaining vital organ health, particularly for men as they aged. Ancient Chinese medicine warned that blocking natural flow creates dangerous internal pressure and inflammation. But today's fast-paced lifestyle has conditioned millions of seniors to ignore these critical body signals, leaving them vulnerable to progressive prostate enlargement and the devastating sleep disruption that destroys quality of life. These ancient practitioners knew that fighting against your body's natural rhythms accelerates aging and disease in ways that modern medicine is only now beginning to understand. Groundbreaking research from Harvard University following over 31,000 men reveals shocking findings about prostate health that most doctors never share with their patients. Men who made simple daily adjustments to their urination habits and intimate health experienced a dramatic 33% reduction in prostate cancer risk, while also significantly improving sleep quality and daytime energy levels. Even more alarming, a separate 10-year study, tracking 2,400 men, over 60 found that those experiencing chronic sleep disturbances from frequent nighttime urination had nearly double the risk of aggressive prostate disease, yet most had no idea this nightly struggle was signaling serious health deterioration happening inside their bodies. I'm Dr. Sarah, and I need to share some vital information about prostate health that could completely transform your sleep, your confidence, and potentially save you from years of progressive decline that millions of men accept as inevitable aging. What I'm about to reveal about simple daily habits could restore the peaceful nights and masculine vitality you thought were gone forever. Subscribe now, because this video combines shocking new Harvard research with ancient wisdom that every single man over 60 deserves to know immediately before permanent damage occurs. Before we dive in, tell me, where are you watching from today? How many times did you wake up last night to use the bathroom? If this is your first time here, don't forget to subscribe for more life-changing health insights that could transform your well-being and restore the vitality you deserve. Today, I'm going to share 3 critical insights that could transform your prostate health and restore those peaceful nights you deserve. First, I'll reveal exactly why that seemingly harmless habit of holding your urine creates dangerous internal pressure that accelerates enlarged prostate symptoms. Second, I'll share the surprising Harvard research about natural prostate protection that most doctors never discuss with their patients. And third, I'll give you my proven 3-step system that I use with my patients to naturally support prostate health while working alongside their medical care. Let me start with something that might surprise you. In my 23 years of practice, I've worked with thousands of men over 60 dealing with frequent urination. And I can tell you this, what you're experiencing isn't just normal aging. These symptoms are your body's way of telling you that your prostate needs attention. And the good news is that simple daily changes can make a remarkable difference when combined with proper medical care. Your prostate works like the main valve in your home's plumbing system. Just as a valve controls water flow through your pipes, your prostate controls urine flow through your urethra. When this small gland becomes enlarged, a condition we call benign prostatic hyperplasia, or BPH, it's like having a partially closed valve that restricts smooth flow. This creates backup pressure throughout your entire urinary system, just like when you have a clog in your kitchen pipes. What makes this particularly challenging for men your age is that this enlargement happens gradually. You might first notice you're waking up once or twice at night to use the bathroom. Then it becomes 3 or 4 times. Soon you're dealing with a weak urine stream, difficulty starting urination, and that frustrating feeling of incomplete bladder emptying. These enlarged prostate symptoms affect over 50% of men over 60. But here's what I want you to understand. This progression isn't inevitable. The research I coordinate with other healthcare professionals shows us that men who make specific lifestyle adjustments while working with their doctors experience significantly better outcomes than those who simply accept these changes as unavoidable aging. Your prostate health can improve, your sleep can be restored, and your confidence can return. But here's what surprised me most about natural prostate care. The biggest mistake I see men making actually accelerates their problems. It's the habit we discussed in our introduction: holding in urine when your body signals it's time to go. Many of my patients think this shows discipline or convenience, but what it really does is create dangerous pressure throughout your plumbing system. When you delay urination, you're forcing your bladder to stretch beyond its comfortable capacity. Think of your bladder like a flexible water balloon. When you overfill it repeatedly, the balloon loses its ability to contract effectively. This weakened contraction means your bladder can't fully empty, leaving residual urine that creates the perfect environment for bacterial growth and increased prostate irritation. Even more concerning is what this does to your prostate itself. That backup pressure from an overstretched bladder travels through your entire system, putting constant stress on your prostate gland. Over time, this chronic pressure contributes to inflammation and accelerated enlargement. It's like constantly running water through partially clogged pipes. Eventually, the whole system starts to fail. I always tell my patients that your body's urge to urinate is like a wise friend giving you important advice. Ignoring this signal consistently teaches your system to dysfunction. The men in my practice who learn to respond promptly to their body's natural signals almost always experience improved urine flow and better sleep quality within just a few weeks. I'd love to hear about your experience with these urinary habits. Have you noticed patterns between holding urine and your nighttime bathroom trips? Share your observations in the comments. Your insights help other viewers understand they're not alone in this struggle. Now, let me share something that might make you uncomfortable, but it's too important to ignore. In my practice, patients often ask about the connection between sexual activity and prostate health. Specifically, they want to know if masturbation helps or harms their prostate. This topic carries so much stigma that most men never discuss it with anyone, yet the scientific evidence is remarkable. The Harvard University study I mentioned followed over 31,000 men for nearly 20 years. What they discovered challenges everything most people believe about male sexuality and aging. Men who maintained regular ejaculation, whether through sexual intercourse or masturbation, had a 33% lower risk of developing prostate cancer compared to men with infrequent activity. Here's why this happens, using our plumbing analogy. Regular ejaculation acts like flushing your pipes with clean water. It helps clear out cellular debris, old secretions, and potentially harmful substances that can accumulate in your prostate over time. This natural cleansing process reduces inflammation and keeps your system functioning smoothly. The key word here is regular, not excessive. The research suggests that moderate, consistent activity provides the most benefit. What I've observed in my practice is that men who maintain this natural rhythm while respecting their energy levels and overall health report better sleep, reduced anxiety about prostate problems, and improved confidence in their masculine vitality. Before we continue, I want to emphasize something crucial. These natural approaches work best as part of comprehensive healthcare. I always encourage my patients to discuss any new wellness strategies with their medical providers, especially if they're managing other conditions or taking medications. Your doctor knows your specific health picture best, and coordinating these lifestyle changes with your medical care gives you the strongest foundation for improvement. In a moment, I'll share the mistake most people make when trying to improve their urine flow naturally, but first, let me give you the 3 foundation habits that create the most dramatic improvements for my patients. If this information has been helpful so far, please hit that subscribe button so you don't miss what I'm about to share next. It could be the key to finally sleeping through the night again. The first foundation habit is strategic hydration. Most men think they should drink less water to reduce nighttime urination, but this actually makes the problem worse. Concentrated urine irritates your bladder and prostate, creating more urgency and discomfort. Instead, I teach my patients the timing technique. Drink most of your daily water before 2 p.m., then taper off in the evening. This ensures your body stays properly hydrated while your system processes most fluids well before bedtime. Research shows this approach can reduce nighttime urination frequency by up to 40%, while maintaining the clean flow through your pipes that your prostate needs. The second foundation habit is what I call circulation activation. After meals, your body naturally redirects blood flow to support digestion. This temporarily reduces circulation to your pelvic area, which can worsen prostate inflammation. A simple 10 to 15-minute walk after eating helps maintain healthy blood flow to all your organs, including your prostate. Studies tracking men over 60 found that those who took gentle post-meal walks experienced 35% fewer enlarged prostate symptoms compared to those who remained sedentary after eating. This isn't strenuous exercise, just a comfortable pace around your neighborhood, or even walking in place while reading or watching television. The third foundation habit addresses what we discussed about sexual health. Maintaining regular intimate connection, whether with a partner or through self-care, supports your prostate's natural cleansing function. This doesn't mean forcing anything unnatural, it means honoring your body's wisdom and not allowing fear or shame to override what science shows us is beneficial. What questions would you ask your healthcare provider about adding these natural approaches to your routine? Comment below your questions, help me create better content and guide how I explain these topics to my patients. Now, here's something most doctors don't tell their patients about foods that can either help or harm your prostate health. Your dining table is one of the most powerful places to begin protecting your prostate, yet many men focus entirely on medical treatments while ignoring this daily opportunity. The most protective food I recommend is anything rich in lycopene, the compound that gives tomatoes, watermelon, and pink grapefruit their red color. Research shows men who consume lycopeneric foods regularly have up to 28% lower risk of prostate cancer. Lycopene acts like a protective coating for your pipes, reducing inflammation and supporting cellular repair. Cooked tomatoes provide the most available lycopene, so tomato sauce, tomato paste, and even pizza sauce count. I tell my patients that a simple pasta with marinara sauce isn't just comfort food, it's prostate medicine when you understand the science behind it. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain powerful compounds called sulforaphanes that support your body's natural detoxification processes. Think of these vegetables as helping your system filter out harmful substances before they can accumulate and create problems in your prostate. Zinc is absolutely essential for prostate health, especially as you age. Your prostate contains the highest concentration of zinc in your body, and deficiency directly contributes to enlargement and dysfunction. Pumpkin seeds, oysters, and grassed beef provide excellent zinc sources. I often tell patients that a handful of pumpkin seeds daily is like giving your prostate the minerals it needs to maintain its proper size and function. On the other hand, highly processed foods, excessive sugar, and too much red meat can increase inflammation throughout your body, including your prostate. It's like pouring sludge into your clean plumbing system, everything starts working less efficiently. But here's what I find encouraging about nutrition and prostate health. You don't need perfect eating habits to see improvement. Small, consistent changes make a real difference. Adding one prostate-supporting food to each meal while reducing one inflammatory food creates momentum that builds over time. The next insight I want to share changed how I practice medicine and could revolutionize how you think about healing your prostate naturally. Sleep is when your body produces the most powerful anti-inflammatory hormones, including melatonin and growth hormone. For men over 60, quality sleep becomes even more critical because this is when your prostate does most of its cellular repair and recovery. Poor sleep creates a vicious cycle. Prostate problems disrupt sleep, and disrupted sleep worsens prostate inflammation. A 10-year study following over 2,400 men found that those experiencing chronic sleep disturbances had nearly double the risk of aggressive prostate disease. This isn't just correlation. Poor sleep elevates cortisol levels while suppressing testosterone and melatonin production. Your hormonal balance becomes disrupted, creating the perfect environment for prostate enlargement and dysfunction. The solution involves creating what I call prostate-friendly sleep hygiene. Keep your bedroom cool, and completely dark light exposure, even from digital clocks, can disrupt melatonin production. Avoid screens for at least 1 hour before bed, as blue light interferes with your natural sleep hormones. Create a consistent bedtime routine that signals to your body it's time for repair and restoration. If frequent bathroom trips continue disrupting your sleep despite following the hydration timing I mentioned, this might indicate you need additional medical evaluation. Persistent nocturia can signal underlying conditions that require professional attention alongside these lifestyle approaches. What I'm about to tell you ties everything together and shows why this systematic approach creates such dramatic improvements for men dealing with enlarged prostate symptoms. Let me share Kenneth's story, one that perfectly illustrates what I see regularly in my practice. Kenneth is 6'8", a retired electrician from Ohio. He's been married to Susan for 40 years and is a grandfather of 5 who loves spending quiet evenings reading. Kenneth came to me already working well with his doctor. What he wanted was to stop waking up 3 to 4 times every night to urinate, which was leaving him exhausted and frustrated. His weak urine stream and difficulty starting urination were affecting his daily confidence, and he was worried about the progression of his benign prostatic hyperplasia. I coordinated with Kenneth's medical team, and together we added the 3 foundation habits to his routine: strategic hydration timing, post-meal circulation walks, and maintaining regular intimate health. We also improved his diet with Lycopene-rich foods and zinc sources while creating better sleep hygiene practices. Within 6 weeks, Kenneth noticed he was only waking up once per night instead of 3 or 4 times. His urine stream became stronger, and he felt much more confident in social situations where he previously worried about frequent bathroom trips. Kenneth's doctor was pleased with his progress and how he took an active role in his wellness journey. Today, Kenneth continues both his medical care and these natural approaches, feeling more energetic and sleeping peacefully through most nights. He tells me that understanding his prostate health gave him back his confidence and improved his relationship with Susan because he's no longer constantly tired and worried. This systematic approach works because each element supports the others. Proper hydration keeps your pipes clean. Gentle movement maintains healthy circulation. Natural intimate health provides protective cleansing. Nutritious foods reduce inflammation, and quality sleep allows optimal healing. When combined, they create a powerful foundation for prostate wellness that works alongside medical care. If this comprehensive approach feels overwhelming, start with just one change, perfecting your hydration timing as we discussed. Once that becomes natural, add the 10 to 15-minute post-meal walk. Building one habit at a time creates lasting change without stress or pressure. Remember, these lifestyle strategies work best as part of complete healthcare. Regular medical checkups, appropriate screening, and professional guidance when symptoms occur remain essential components of prostate health for men over 60. I always encourage coordination between natural approaches and medical care because this combination provides the best outcomes. If this evidence-based approach resonates with you, please subscribe for more wellness education that honors your relationship with your healthcare provider. Remember, I'm here to educate, not replace your doctor's care, and these insights work most powerfully when integrated with professional medical guidance. Here's something that might surprise you about BPH treatment. Without surgery, many men experience significant symptom improvement through these natural methods when they're implemented consistently and coordinated with their medical team. The key is understanding that your prostate responds to comprehensive care, not just single interventions. For men dealing with frequent urination and difficulty urinating, these approaches address root causes rather than just managing symptoms. When you support your body's natural healing processes through proper hydration, circulation, nutrition, and sleep, you're giving your prostate the environment it needs to function more effectively. The beauty of this approach is that it enhances whatever medical treatment you're receiving. Whether your doctor recommends watchful waiting, medications, or other interventions, these lifestyle changes improve your overall health and can enhance treatment outcomes. If this reminds you of someone who might benefit from this information, please share this video with them. Sometimes, sharing knowledge is the kindest gift we can give, especially when it involves sensitive health topics that many men feel uncomfortable discussing. What I want you to remember most is this: you're not powerless against prostate problems. While some enlargement is common as you age, the severity of symptoms and impact on your quality of life can be significantly influenced by the choices you make every day. The research supports these approaches. My clinical experience confirms their effectiveness, and most importantly, they can be safely integrated with whatever medical care you're receiving. Your prostate health affects so much more than just urination. It impacts your sleep, your energy, your confidence, and your overall quality of life. By taking these steps now, you're investing in better days and peaceful nights for years to come. Next week, I'll be sharing crucial information about the warning signs that every man over 60 should never ignore symptoms that require immediate medical attention versus those that can be addressed naturally. It's knowledge that could literally save your life, and I think you'll find it just as empowering as today's information about natural prostate support. Thank you for trusting me with your health education. Remember, these insights work most powerfully when you share them with your healthcare provider and create a collaborative approach to your prostate wellness. Sweet dreams and better health ahead.